So the Darby Military Community, we're going to be hosting the booster vaccines as well as pediatric vaccines on 13 December. The pediatrics, we're going to start out early in the morning, right when they're getting to school, so they'll be able to have their parents present, calm them down a little bit. We'll be completing all of their paperwork and then starting the Pfizer vaccine for our pediatric patients. I'm Tech Sergeant Eric Martinez. I'm an IDMT assigned to the 731st Munitions Squadron. We're going to plan on doing their second dose on 6 January. So on that date, we're going to do the whole thing all over again. Our team from Vicenza Health Clinic is going to come down. We're going to head over to the school and complete their second dose of COVID vaccines. For our booster vaccines, we're going to start after we finish up with the kids. We'll head over to the Warrior Room, get set up, and then we'll be providing the booster vaccines to our community. We're hoping to be able to provide Johnson & Johnson, Moderna, and Pfizer, all depending on what the people want to have for their boosters. According to the CDC, we need these booster shots because our immunity shows to decrease throughout the year. Over the past couple months, we've noticed a decrease enough that we want to provide those booster vaccines to get our immunity against COVID-19 up over 90% again, to prevent the spread throughout our community and ensure that our symptoms aren't as severe, requiring hospitalization.
We haven't yet seen any symptoms that are unique to Omicron. The symptoms that are presenting are the very similar symptoms that we have seen with Delta. We have about 90,000 new cases a day here in the United States, and right now, 99.9% of them still are the Delta variant.
We are entering the third school year affected by COVID-19, and following the FDA's full approval of one of the COVID-19 vaccines, we strongly encourage all educators and students to get vaccinated. Vaccination's the leading public health strategy to end the COVID-19 pandemic. I'm Deborah Devine Sherman. I'm the school nurse at Livorno Elementary Middle School. The more of us that are vaccinated provides immunity and will provide that herd immunity to our students that cannot be vaccinated for certain health reasons. So it's really important that we as staff members, especially school nurses, understand the importance of vaccination.
First and foremost, it's really hard for us to get COVID vaccines down here. So if we're able to provide vaccines at this time, I recommend you get it because we don't know the next time we're able to get a shipment of vaccines into our community. Second, it's to protect yourself, the community, and your family members. You want to ensure you get vaccinated just to lower your chances of getting COVID-19. It won't say that you won't get it completely, but you got a smaller chance of contracting COVID-19 and your symptoms won't be as severe. To save time during the actual appointment date, if you could pre-fill out the DD Form 207s that were previously sent out for anybody 11 and older, and the DD Form 236 for the pediatrics between 5 to 11, that's going to save a lot of time when we get to the when we actually give out the vaccines.
I chose to get the COVID vaccine and now the booster so I can do my part to protect myself, my family, my students, and my community. Vaccination is the best way to stop the spread of COVID and help to save lives.